take for granted the ability to talk with our healthcare provider. For some of our neighbors, there is a language barrier to receiving adequate care. In today's Health Watch, Tirsa Smith shows you a program looking to decrease healthcare disparities in the Latino community by opening lines of communication.
Imagine being in the middle of a medical emergency and not being able to communicate with your doctor because you speak Spanish.
So we thought, we have a lot of people who are bilingual, not even bilingual, but multilingual. We have a lot of people who speak dialects. How do we get them in these positions where they're able to make the healthcare landscape look more equitable? And so when we started thinking about that, we thought, okay, well, there's a lot of people who want to go into higher education and they want to go into the medical field. Let's get them started as medical interpreters, give them the training that they need.
Centro Hispano's medical interpreter training program is on its third cohort of aspiring medical interpreters. It started as a partnership with UT Medical Center, but now they've expanded to 5 local medical centers.
Having someone that's there and can advocate for you and let the provider know, hey, this is what the patient is saying, this is what the patient needs, it really puts the patient back in control of their own health care.
The program helps fill the gap for a growing Hispanic population.
Because we're here for them, obviously we're there for the doctor as well, for him to be able to give the message, but we're mostly there for our patients because we don't want them to feel left out or less because they cannot communicate.
Aspiring medical interpreters like Daniela Lopez and Erica Tomas attended workshops, role-playing scenarios, learned medical vocabulary, and will also undergo a practicum.
And I think it's very important to build that kind of relationship with our community that they can trust us in interpreting for them, because there is a scarcity in interpreters. And for me, knowing 3 languages, it's very important to be able to use the skills that I was given to help others.
So it's a common misconception that if you're bilingual, you can be a medical interpreter. It's a lot more than that. You need to know terminology, you need to know the ethics behind it. A lot of people think, okay, if I speak Spanish, if I speak a 3rd language, I can be a great medical interpreter, but that's not the case.
Centro Hispano's medical interpreter training program is on its 3rd cohort, and their soon-to-be new jobs are in high demand. For Health Watch, Tirsa Smith, 6 on your side.
If this sounds like something you would like to do, you need to be bilingual in English and Spanish. You will need to complete a language fluency evaluation. We have more details for you on our website, or you can contact Centro Hispano.